Hello and welcome. Thank you for attending the in-service training. According to New York State regulations, personal care aides, PCAs, and home health aides, HHAs, must complete orientation training before beginning work and are also required to complete annual in-service training to maintain their eligibility for employment. Personal care aides, PCAs, must complete orientation and 6 hours of in-service training each year. Home health aides, HHAs, must complete orientation and 12 hours of in-service training annually. By the end of this training, the learner will be able to identify the following: Health Insurance Portability and Accountability Act of 1996, HIPAA, Plan of Care, Infection Control, and Standard Precautions, Emergency Response, Transfer Techniques, Advance Directives, and Hospice. First, we are going to talk about HIPAA. Personal care aides, PCAs, and home health aides, HHAs, must comply with HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. It is a federal law protects the privacy of a person's health information, making healthcare communication confidential. Verbal or written information must not be obtained by an unauthorized person. The penalties for non-compliance are based on the level of negligence and can range from $100 to $50,000. With a maximum penalty of $1.5 million per year and imprisonment for up to 10 years. Plan of care. Home visit nurse will create a plan of care for patient every 6 months. It lists all the tasks that personal care aides, PCAs, and home health aides, HHAs, need to perform. For example, light housekeeping, preparing meals, shopping, medication reminder, accompany to medical appointments, person care, such as bathing, dressing, skin care, etc. Aides can only perform tasks listed in Plan of Care. Safety is our priority. Any changes in patient's condition, please inform our agency immediately. Regular hand washing is one of the best ways to remove germs, avoid getting sick, and prevent the spread of germs to others. You can help yourself stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Arrival at patient's home, before and after eating and preparing food, before and after caring for someone who is sick with vomiting or diarrhea, before and after treating a cut or wound, after using toilet, after changing diapers, or cleaning up someone who has used the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after touching garbage, after touching objects that people frequently touch with their bare hands, such as elevator buttons, door handles, before touching your eyes, nose, and mouth, after touching your mask, before putting on gloves, and again immediately after removing gloves, and when hands are visibly soiled. Follow these steps every time you wash your hands. Wet your hands with clean, running water. Apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the Happy Birthday song from beginning to end twice. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. Use the paper towel to turn off the tap. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply the hand sanitizer to the palm of one hand. Rub hands together until they are dry. This should take around 20 seconds. When to wear gloves. Wearing gloves helps protect both patients and healthcare workers from infection. Wear gloves every time you touch blood, bodily fluids, bodily tissues, mucous membranes, or broken skin. You should wear gloves for this sort of contact, even if a patient seems healthy and has no signs of any germs. How to remove gloves. Grasp the outside of one glove at the wrist. Do not touch your bare skin. Peel the glove away from your body, pulling it inside out. Hold the glove you just removed in your gloved hand. Peel off the second glove by putting your fingers inside the glove at the top of your wrist. Turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second. Dispose of the gloves safely. Do not reuse the gloves. Clean hands immediately after removing gloves. When do you activate emergency response? Falls. According to CDC, falls and the injuries and deaths they cause are increasing. Each year, millions of older people, those 65 and older, fall. If the patient that you take care of loses consciousness, has uncontrolled bleeding, fracture, head or spinal injury, strong or lingering pain after a fall, call 911 immediately. Anaphylaxis is a serious allergic reaction that is rapid in onset and may cause death. It typically causes more than one of the following: an itchy rash, throat or tough swelling, shortness of breath, nausea and vomiting, dizziness, or unconsciousness. Call 911 if your patient experiences signs or symptoms of anaphylaxis. Hypoglycemia. Common symptoms are dizziness, sweating, shaking hands, hunger, rapid heartbeat, weakness, and inability to concentrate. Rare but serious symptoms: confusion, sudden changes in behavior and mood. If a patient develops symptoms of hypoglycemia while awake, he or she can be given high-sugar foods that can increase blood sugar quickly, such as 2 to 3 candies or 100 milliliters glucose water. Patients should test their blood glucose 10 to 15 minutes after eating. If the blood glucose is still less than 70 mg/dl, they should eat the above foods repeatedly. If the blood sugar still fails to rise after repeated treatments for 3 times, please seek medical treatment immediately or call 911 for help. Hyperglycemia. Symptoms include frequent urination, extreme thirst, bellyache, nausea, rapid breathing, and in severe cases, coma. If the blood sugar is higher than 450 mg/dl, seek medical treatment as soon as possible. If the blood sugar is higher than 270 mg/dl, the patient should also test the urine for the presence of ketones. The symptoms of ketoacidosis, DKA, have a sweet and fruity breath. If ketone bodies appear in the urine, you must seek medical treatment as soon as possible. Heart attack, also called myocardial infarction, happens when a part of the heart muscle doesn't get enough blood. The common symptoms of heart attacks are squeezing central chest pain, or mild chest discomfort, shortness of breath, clammy, sweating, pale, and dizziness. Pain characteristics are tightness and pressure. Patient often feel anxious. The pain may radiate to shoulders, jaw, ears, arms, and wrists.
It usually lasts for 3 to 5 minutes. If you suspect your patient is having a heart attack with no relief from sublingual nitroglycerin, you should call 911 immediately without delay. Cerebrovascular accident, or stroke, occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. The acronym BFAST is a handy technique to help you quickly recognize common signs of a stroke. B is balance. Patient may have trouble walking, dizziness, loss of balance, or lack of coordination suddenly. E is eyes. Patient may have sudden trouble seeing in one or both eyes. F is face. Patient may have sudden numbness or weakness in the face, especially on one side of the body. A is arms. Patient may have sudden numbness or weakness in arm or leg, especially on one side of the body. S is speech. Patient may have sudden confusion, trouble speaking, or difficulty understanding speech. T is time. Brain cells begin to die in minutes. A stroke is a medical emergency, and prompt treatment is crucial.
Patient may become paralyzed on one side of the body, or lose control of certain muscles. Caregivers need to know how to help a stroke patient walk and how to transfer patient safely. If the walking aid is a stick or a quad stick, it is always held in the stronger hand of patient. For quad sticks, ensure it has been adjusted to right or left hand use. Always remember that the wider and angled legs of the quad stick should be facing out. The height of the walker should be the level of the wrist of the patient when she is standing. Majority of the walkers sold are height adjustable. Walking the patient, always stand on the weaker side of the patient. Caregivers need to use proper body mechanics and transfer techniques for safe transfer. Please watch the following videos with English subtitles for transfer techniques.
坐低企起身，上床落床，呢啲都係我哋每一日會進行嘅基本動作。以下嘅片段呢，就可以等我哋睇下喺呢啲日常生活嘅環節入邊，點樣為有活動困難嘅長者提供協助嘅初步概念。
喺開始示範之前，等我哋先認識扶抱8大原則啊！呢8大原則除咗能夠應用於協助長者身體位置轉移，亦都可以運用喺使用輔助器具嘅情況，亦都可以應用喺日常生活嘅搬抬或者提舉工作當中，以減低受傷嘅機會。大家可以因應個別嘅情況靈活運用。 扶抱嘅8大原則。第1項，事前準備。喺扶抱長者之前，我哋應先分析長者嘅狀況、自己嘅能力、環境嘅需求，而去判斷使用乜嘢嘅扶抱方法同埋使用乜嘢嘅輔助器具。另外，護老者適宜穿着一啲合適嘅衣服鞋襪，仲要除咗身上高有機會阻礙扶抱嘅物件，例如手錶或者飾物。喺預備轉移之前，要留意長者嘅狀況。如果長者有未愈合嘅骨折、脫臼或者痛症，就要小心，唔好令患處受力啦。如果有喉管嘅，要注意唔好拉扯。如果有尿袋，就要留意尿袋嘅位置，應該放於低於膀胱嘅水平，以免尿液倒流嘅。同時要幫助長者坐穩，亦要為長者整理衣服、鞋襪同姿勢，使到轉移嘅過程更加容易。大家有冇留意到，當長者坐喺度嘅時候，雙腳如果放得太前或者身體後傾，都會增加企起身嘅困難呢？相反，當長者坐喺度嘅時候，實踐喺腳尖嘅正上方，要企起身嘅時候，身體傾前，亦即係膝關節有啲微曲，身體重心略為向前，咁就大大唔同噶啦，佢就會更加容易企起嚟啦。環境方面，要清除途中嘅障礙物，地面要乾爽，同埋要有充足嘅光線，要預備所需用嘅器具，例如將輪椅擺放喺合適嘅角度、位置同地方。謹記事前嘅準備唔可以缺少噶，仲要鎖好車禍，佢會令整個嘅轉移同埋扶抱過程更安全、更有效率同埋更暢順。第2項原則係向長者解釋、指導同埋取得佢嘅合作。溝通方面，應先向長者解釋、指導，令到長者明白之後，等佢可以合作嘅。有冇試過長者過床嘅時候會伸手拉住自己張床或者張凳啊？出現呢個情況係因為大家都未有共識，咁樣會增加喺轉移上嘅困難。另外，要鼓勵長者主動參與轉移嘅過程，因為長者嘅參與唔單止可以減輕護老者嘅負荷，最重要嘅係可以令到長者有運用現有機能嘅機會，從而保持活動能力，減慢衰退。第3項原則係正確嘅姿勢，即係扶抱長者嘅時候要保持腰背挺直、收緊腹部同埋紮馬嘅。因為當腰背挺直嘅時候，腰背所受嘅壓力會較少，而收腹有助腰腹嘅肌肉收緊，而加強腰背嘅保護。另外，紮馬可以令護老者企得更穩，同埋可以以下肢發力，從而減少腰背受傷嘅機會。第4項原則係緊抱長者。緊抱長者嘅時候，長者要感到舒適，又唔可以俾佢跌倒。究竟點樣緊抱長者先可以提高長者同護老者嘅安全，又能夠減低身體各關節嘅勞損呢？答案係護老者要以較大嘅關節同埋肢體較強嘅部位去承托長者。以護老者嘅上肢為例，前臂較手腕強，所以可以考慮用前臂嚟承托長者。另外，護老者亦都唔好過分屈曲關節，以免增加關節嘅負荷。第5項原則係盡量靠近長者。有冇試過喺搬抬物件嘅時候，因為槓桿原理，雙手同物件嘅距離越遠，物件就好似變得越重呢？同樣道理，扶抱長者嘅時候，護老者應該盡量靠近長者，因為扶抱嘅距離越遠，護老者唔單止感到更加吃力，仲會增加咗身體，尤其是腰背嘅負荷。另外，盡量靠近長者嘅時候，護老者嘅肢體就可以避免過度伸展。第6項原則，護老者嘅其中一隻腳要指向目的地，同埋要以下肢發力。 腳尖指向目的地，例如輪椅，能夠幫助護老者順暢而有效咁轉移重心。用下肢發力，即係用身體最強嘅大腿肌肉嚟發力，咁就可以減輕腰背同埋上肢嘅負荷啦。第7項原則係由一位護老者發號施令，即係喺長者能夠同步參與轉移過程嘅情況，又或者長者嘅身體太重或者太弱，需要由2位或以上嘅工作人員協助嘅時候，咁就要由其中1人發號施令，咁樣大家就可以更合拍，以減低受傷嘅機會。另外，發號施令嘅時候，大家要數1、2、3之後先發力啊，定係數到第3聲嘅時候發力呢？呢個亦需要事先溝通清楚，以加強默契。第8係利用輔助器具，喺情況許可下，要盡量使用合適嘅輔助器具，以減輕護老者身體嘅負荷。不過，無論使用任何嘅器具，亦都要遵守同埋靈活運用上述所講嘅扶抱原則。
Other situations that need to active emergency response are difficulty breathing or choking, consistent fever that won't come down with medication, severe new onset pain, black or bloody stool, new onset severe hematuria, seizure. Our home care agency supports and respects each patient's participation in their own healthcare decisions, which is the right of New York state law. Our home care agency has specific policies and procedures to ensure that patients have the opportunity to participate in their own healthcare decisions. Our home care agency assessment nurse will discuss with the patient concerning advance directives during the initial assessment and record it in the patient's medical record. Please know that when someone is admitted to hospice, caregivers are expected to call the hospice emergency number, not 911. Caregivers need to notify our home care agency if patient has any incident or episode of fall or hospitalization. And please do not hesitate to call 911 when patient and your life are in danger. I hope the above is useful to you. If we can be of assistance, please do not hesitate to contact us by phone or visit us in person.